Good afternoon and welcome to today's webinar focused on demystifying evidence-based practice. Today I'm honored to be joined by one of our authors, Dr. Nola Schmidt, who will discuss tips and strategies for engaging students in nursing research. She'll also preview the upcoming 5th edition of both her and Janet Brown's newest text, Evidence-Based Practice for Nurses, Appraisal and Application for Research, which will publish a little bit later this summer. So before I turn it over, I just want you to meet the presenter. That's Dr. Nola Schmidt. She is one of our authors here at Jones and Bartlett Learning, has been for quite a while. She also has 25 years of nurse educator experience, and she is currently a professor at Valparaiso University in Indiana. Welcome today, Dr. Schmidt, and I'm going to turn it over to you now.
Thank you so much, Jennifer, and thanks to all of you who are here today. I really appreciate your tuning in. And in general, what I'm going to do today is present to you an case study that you can use to engage students in the steps of the EBP project. So basically, this is an assignment that you can use in a research EBP course. Okay, so probably a lot of you do teach research or EBP, and that's why you're here. And I know that it's really hard to get students engaged in this because they're very focused on their clinical courses and they don't always appreciate research and EBP. So hopefully we can move students from being mystified to being more engaged in the classroom. And get them enlightened about the importance of evidence to their practice. Okay, so just to remind you of the EBP Team Project assignment, it begins by assigning topics to groups and then having them formulate a PICO question, a search for literature, and then they use that evidence to make a summary grid. And then they decide whether or not to change practice or whether more research is needed. They create a plan, and then they also present a poster. You can find more information about this assignment in that article cited at the bottom from 2007, but really everything you want to know is here because I've got the more updated version. So here is an example of the project instructions that I provide for students, and they're very detailed, but I've found over the years that the more detail I provide, the better job they do on their assignments. So this is kind of a step-by-step thing that the students have to do to get through the assignment, and you can see that all the teams go through those first steps of the EBP process, and then after they decide whether or not there's enough evidence practice, they'll either write a policy and do something in that direction, or they'll identify a research question and do something in that direction. And so what I'm going to do today is kind of walk you through what I do on my end to get the students through their project. Okay, so the first thing is how do you decide what students to put in the teams? And should you do random or self-assigned? And I have found that random works better. I've on occasion let them self-assign, and there are always students who are left out, and it doesn't start the course off in a good way. And so I've been going with random assignment. Once they're in their teams, I have each team select a chair, and I tell them that the chair is in charge of coordinating communication, and you know, if you're going to be absent, you contact the chair and that kind of thing. And I get them hooked in by telling them this will look good on their resume. And so that's how students often volunteer to be a chair. Then I have each team set ground rules. And their ground rules are a list of expected behaviors of the team members. And I use this as the criteria for peer grading. When I first started this project, I just had peer grading and there was no criteria. And it was really difficult for them to grade their peers because they didn't have any criteria. And also it was hard for me to do individual group contributions, grade the students' performance individually, because I wasn't really with the groups. And so by having them set their expected behaviors, like turning things in on time and being polite and that kind of thing, it really has clarified the grading for peers. And each team then, when they formulate their ground rules, forwards me their ground rules. I've also been able to use this for problem solving. So when there's conflict in a team, or when someone wants to really grade someone poorly, we can go over those criteria and say, well, did they come to the meetings? Did they call in when they were absent, or whatever their behaviors are? So I really encourage them to do that. EBP topics, picking them, either you can let the groups determine them or you can assign them. I used to let them pick, and for about 2 semesters, and that really did not go well, because they would, first of all, they struggled for finding an idea. And then once they had an idea, sometimes they'd get really frustrated because there'd be no evidence out there for them. So now I assign them, and it goes much more smoothly. And I'll give you some direction about how I do that. Okay, but if you don't want to go out and find topics, you can use the Applied What You Have Learned component that's found in our textbook. And so in our textbook, our topic or problem is hand hygiene, lack of hand hygiene. And so we have a whole list of articles that we've found for you, and throughout the book, we introduce different articles at different points of time, and you can use this Apply What You Have Learned section to be a EBP project. I also use these articles as examples in class, so they match well with the chapter. So for example, in a sampling chapter, the article I've chosen has some good information about sampling. So you could use the Apply What You've Learned. I do not. I pick other topics. And so let me tell you a little bit about assigning topics to groups. I go and I systematically search CINAHL, JBI, and Cochrane. And all I put in are the terms systematic review, meta-analysis, metasynthesis, and integrative review. And then I use limiters of English, and I go back a few years, and I do this purposefully because I want them not only to find these systematic reviews between 16 and 18, but I also want them to find studies that have been conducted since the systematic review has been published. If I use a systematic review insert that's like 2021, then they're not really going to look for any more studies because they found this really high level of evidence. This also assures that they're going to find a piece of evidence that will get them going. I found that when they find that piece of evidence, they're very excited and they can move forward. Now, the evidence doesn't always say that practice should be changed. Sometimes the result of the systematic review is that more evidence is needed. So that just because there's a systematic review doesn't guarantee that they have enough evidence for practice. And so I skim the titles and read the abstracts, and I pick the topics based on the ones that I run across. And then when I see ones that I like, I create a scenario for each topic. And so here are 3 team scenarios to give you an idea. The first one is about nurses who are working in COVID, and they're trying to reduce injection site pain. And the second example is about nurses who are working in a pain clinic and want to investigate whether acupuncture will help reduce opioid use. And the third example is about caring for members of the LGBTQ+ community and how we can make our healthcare environments more friendly for that population. Okay, and so next you want to have them formulate a question. So up until about 2 years ago, I always went with the PICO question. And the problem I found is that it's really forced for some of the scenarios. And so now that I've moved to having them do a PICO or a best practice question, like what is the best practice for acupuncture and an opioid in a pain clinic, the students are able to wrap their mind around that better. Sometimes the PICO is problematic because in the scenario, there isn't a comparison group. It's just kind of like, well, whatever's going on in this imaginary scenario already that I don't really articulate. And so that's why I've moved to best practice. But if you want to stick with the PICO question, and I know I call it PICO, but some people call it PICO and some people call it PICO, then you can give them this structure to help them formulate their question. Then the students need to, after they've formulated their question, conduct a systematic search of the literature. This worksheet is available on the companion website to the textbook. It's also kind of in the textbook, but not as nice as you would want to use in your class. But it begins by telling students to identify their concepts, the P, the I, the C, the O, and then create synonyms. It walks them through using synonyms for those concepts. And then the next step helps them build a search using Boolean operators or an and then identifying databases and recording the number of hits they get and that kind of thing. And so it's really helpful for them to have this worksheet so that they can make a systematic search rather than just, putting in a bunch of terms and then forgetting what they put in and that kind of thing. So we do spend time, a whole class period, teaching them how to use this worksheet. Okay, and that's only one. We have 4 sessions in my course with the librarian to help them learn how to do a systematic search. And we begin the first session with this using the worksheet and this hands-on advanced search in CINAHL. They've learned the basic search in previous courses, but now we're teaching them to use limiters. We're teaching them how to save their searches. We're teaching them how to use mesh terms and key terms in the second class. In the third class, we introduce them to JBI, Cochrane, and TRIP databases, which they have not used previously. So that's always new content in our curriculum. And then the last class session, they get in their teams and they do a systematic search in an organized way. And the librarian and I are there to help them do that. And so we have each team assign a person to a database, and we have them write their key terms up on whiteboards, and then they all search. And then they huddle back up and say what they found, and they adjust their search based on some terms they found, and then they go back to their databases and search. And usually by the end of the session, they have a few pieces of evidence that really get them going in the right direction. And that alleviates a lot of frustration on their part because a lot of times they go off and they are trying to find evidence on their own and they're frustrated. And so doing it as a group with the faculty there to help them really engages them more. Okay, so then they need to analyze the evidence, and you're all familiar with this type of grid. And so I give them cues in the top about how much should go, how much information should go in each column. And I want you to notice, though, that I've adapted this. And instead of having design, sample, measurement, and so on, I've used PICO to do it, to head the column. So population, intervention, comparison, outcome, time, and level of evidence. And so I have found that this simplifies it for the undergrad students compared to a graduate grid. And I've seen improve using this grid. This grid is also available on the companion website as well as a traditional grid if that's what you want to use. So here's an example of a student grid. It has 2 entries. There'll be more. And best practice, this is back to the topic of best practice for welcoming the LGBT plus members in the community. And so you can see that they have put different articles, an integrative review, a qualitative synthesis, and they've been able to break down the components for those articles. I used to require 1 piece of evidence for each number of students in a group, but my groups have grown, and now my groups are like 8 or 9, and I can't, that's a lot of articles to read. And so this past semester, I cut it down to 5 per group, and that was much more manageable in terms of me having time to grade these. And they still had enough evidence to make a decision. And so I think 5 is a nice place to land. It also allowed them 2 people to read 1 piece of evidence, which made their grids better because 2 heads are always better than 1. And I also have a grading rubric for the summary grid. I use points, but you could adjust these to 100 and use percentages. And I provide the students with this grading rubric so that they know how they're going to be graded. And again, this rubric would be available on the website. The next step for students is to decide whether they're going to change practice or propose a study, okay? And so they can go either way. If they have sufficient evidence, I have them formulate a policy and make a little plan about implementing and evaluating the practice change. If they decide there isn't enough evidence, I have them make a plan for a study and write an abstract that summarizes what their study would be. So I'm going to give you some examples here of my students' work. Okay, so I provide students with a template for their policy, and I have 2 versions of the template. The one template is kind of a step-by-step. You do this, and here's the rationale, and you do this, and here's the rationale, and you do this, and here's the rationale. Versus here's the policy, and then here's the rationale. And so I found that by providing these templates for students, that their policies are much better, because I got things they just didn't know what to put on here. But once you give them the examples, and I also provide them these exact examples so that they can see what to do, and give them the templates, they're good to go. Those templates are also posted on the companion website for the book. So here's an example of one team's policy change. And this one is the one that goes back to the idea of reducing pain, injection pain. And they have a plan here that patients get to pick what they want to do, because they found that the buzzy and the manual pressure were on the shot blocker. All 3 of those were equally effective at reducing pain. So they're giving patients a choice, and then they measure their pain. So you can see that run 1 to 2 pages. So then if they've decided that they have a policy, they need to create a plan. And this plan, they really struggle with this. And that's the nice feature about this textbook, is we just don't stop at research. Then we talk about, at the end, bringing it back. You found the evidence, and now we need to implement it for practice. And so this is, many of you will recognize this as Potter's stages of change. And under each stage, I've provided some activities that nurses can do to facilitate change. And so I have them go to this figure, which is in the textbook, and look at these and come up with some ideas about how they would propose to facilitate the practice change. And so here's an example of a student's plan they are going to implement, and they wrote a paragraph about it. This goes back to the 3 different pain controls include for the injection sites. And then they formulate an evaluation plan. And so these students have decided, for example, that they'll do the VAS scale to be sure that people are having lower pain ratings, and they also are going to do a satisfaction survey. So that's a nice plan for them. If there isn't enough evidence, then I ask students to plan a study. And so they need to identify a research question, and then they need to describe the study, like what design would they use, tell me about the sample, how big it would be, what type of sampling method and so on, how they would recruit people, what are their variables, how are they going to be measured, and what statistical tests do they plan to run to analyze the data. And so here's an example of a student abstract, and they decide that there isn't enough evidence for using acupuncture therapy in a pain clinic, and so they design a study. And that's their abstract, and they've got their citation at the bottom for their documentation. The last thing I do is I have them create a poster. And I'm sure you all appreciate the challenges we faced as educators during COVID. And one of the things that I used to do, was I had them make posters physically, and we put them out in the lobby for other students and faculty to see. And so they printed them out using PowerPoint slides, and then they posted each page. They each got bulletin boards that the college provided for them. But when COVID came, there was no more public presentations or face-to-face. And so I had to move to electronic. And so the first posters that I did electronically, they were really challenged. So the next semester, I made templates for the posters, and the posters were so much better. Sometimes I forget that they're undergrads and they're not experts, and that they need this extra guidance. And so I created a template for people who have a protocol, and I have created another template for students who create an abstract. So I have all the headings there that align with the grading rubric, and they were much better. And so here's an example of the acupuncture topic. And you can see that their poster looks clean. It's a little small font. They like to put a lot of information, but it's so much better. I used to get gobs of sentences and sentences and sentences, and they were crammed. And so this has improved it a lot more. So this is an example of a poster for the practice change. Here's another one where a group decided that they wanted to do that previous one was the buzzy, the pain on injection. This one is the one about acupuncture and opioid consumption, and they decided to use a quantitative design. And so again, you can see that they're unique. Each group comes a different way to it. And then the group about best practice for welcoming LGBTQ+ members decided to go with a qualitative design, because they felt like all the quantitative information really didn't get to the why. And so again, you can see that their poster is unique. I also have grading rubric for the poster. And so you can see that the ones in white are graded for everybody, and then the green are for those who have a policy and are moving forward with evidence. The pink is for those who are having a research question, and then the final one for grading for presentation style. And again, these templates and this grading rubric is available on the website. So what's new in this edition? Well, the first thing that's new is that we have divided the chapter 1 into 2 separate chapters, a chapter for EBP and a chapter about research. We just think that that doesn't overwhelm the students quite so much. And a lot of users of the textbook wanted more information about the levels of evidence sooner in the book. And so we responded to that criticism and moved that content that came later to this first chapter. We also revised the hierarchy of evidence, and we really like this, this hierarchy. As go across the evidence, they would find things like a concept analysis or a narrative review or an integrative review, and they just didn't know where to put it. And so we've taken all those kinds of things and we've stuck them in the levels so that students have one place to go to figure out what level it is. We've even included EBP project and QI project in level 6 because they're finding articles about those as well. Students also, I found, got very confused between the 5 S's and the hierarchy of evidence. And so in this edition, we actually eliminated the 5 S's. So those of you who really like the 5 S's, you'll have to put that content back in yourself. But I think that the hierarchy just goes more, it's just simpler for the undergrads. We updated the Apply What You Have Learned with more recent articles, and we revised the chapter about finding evidence with the new literature worksheet. What I'm really excited about this edition is that we added a chapter about appraising evidence. And so in this chapter, there are links to appraisal tools such as CASP and Johns Hopkins. And I'm debating whether to add an appraisal step to this assignment where they actually have to, when they turn in their grid, turn in an appraisal form for each piece of evidence. I don't know if I want to do that yet. I'm still mulling that over, but I'm leaning towards doing that. We switched the order of the sampling and data collection chapters because we found that data collection needed to refer to some sampling principles, and so we just thought that switch would be good. In addition, we added content about mixed methods because that was a request of some of the users of our textbook. And in our Apply What You Have Learned, there is a mixed methods article included that can be used as an example in class. And then the templates for the posters are new this year. So why do I recommend this textbook? Because it combines research with EBP. The EBP example is threaded throughout the whole text in the Apply What You Have Learned section. And we have already done the footwork for you if finding articles for examples for each chapter. So that really saves a lot of time. The critical thinking exercises we've created could be used in the classroom, and the companion website has all these templates and grading available for you. A lot of what goes on in this assignment is compatible with the standards for baccalaureate education from CCNE and CINA, and so that is helpful. And then, of course, we have a test bank. Why do students find this advantageous? It's easy to read prose. That's what started us on this journey, was that we found that books were either too simple or too complex. We've got that application opportunity throughout the chapters. We also organized the book, if you haven't looked at it before, into small bites. And so each chapter is for a section, starts with objectives, then has content, and then finishes with a couple of questions that are just kind of like quiz questions to help them reinforce the content. Because we recognize that students can't always sit and read an entire chapter in one sitting, and that this way then they can just read a section and have those questions to reinforce. The students like the articles that have examples, and they like the companion website. They especially like the quiz that is available on there. It's 10 questions for each chapter, and they like the flashcards. I get positive feedback about those two features. That finishes my presentation, and I thank you so much for attending. I really appreciate your interest in, making students more cognizant of the EBP process, because nursing really needs to be evidence-based. We owe that to our patients. So now I'll turn this back over to Jen.
Excellent. Thank you so much, Dr. Schmidt. Great presentation, great overview. Loved how you're able to walk through the specific examples. I know that the audience found that really interesting. And yes, there is the new 5th edition of the textbook coming out. It publishes in August. August 25th is the exact date. If you'd like to pre-order a review copy so that you get it as soon as it comes out, I invite you to visit. We have a shortened URL here, go.jblearning.com/EBP5E. And Nola has been gracious enough to list her contact information if you have any other questions that come up, or alternatively, if you'd like to reach out to your account manager about purchasing or adopting the textbook for a fall or January 2022 course, you may do that as well. Also know that there are different digital options that are more affordable options for your students as well. I want to extend a very warm thank you to Dr. Nola Schmidt. Thanks again, everyone. Have a great day.